Now, one other point is that because we do the testing, so depending on who you are, we'll do the half-an-hour testing as well as the 1 hour testing, but something we see not infrequently is an elevated 1 hour test or a half-an-hour blood sugar with a normal 2 hour test. Now, a blood sugar of over 11.1 at any time during this test is consistent with a diagnosis of diabetes. So I suspect there's a lot of stuff, even if we were only measuring glucose, if we included the 1 hour marker into the standard test, it would be a whole lot more diagnostic. Over time, our insulin gradually rises to compensate for the resistance, but there reaches a point where it can't compensate any longer. And then your blood sugar starts to rise. And then several years after that, your insulin secretion reaches a peak. Now, this is what is in common parlance known as pancreatic burnout. Now, I'm going to tell you what causes this. So you've all seen before in my previous lecture what happens when sugar attaches to proteins, glycates them. It leads to the formation of something called advanced glycosulated end products. It leads to cross-linking of proteins and basically defunctions it. Well, this very process has been shown to happen in the cells of the pancreas that make insulin. Now, I don't know if you think that's ironic or not, but the sugar which the insulin is trying to control will actually kill the cells that release the insulin. Now, one of the exciting things that we see, though, is that this process, if you don't get to it too late, is partially reversible. And I can actually test people's ability to secrete insulin. I measure something called C-peptide, and what we're seeing is we haven't been doing it for very long, but the data looks relatively promising at the moment that we're starting to see a restoration of people's ability to secrete more insulin over time. It's taking several months, but it looks quite exciting at the moment. So let's think about this chart of insulin resistance and compare it to patients we've actually seen in the clinic. So these are actually patients which I've seen. So here we see we're right down the left-hand side, healthy days. Blood sugar's low, insulin's low, 10. What happens now? Blood sugar's low, but you can see that insulin has now come up to 83. This is not diagnostic of anything. This individual would go and have standard testing and be told they have nothing to worry about. It's at this point that they might be told they have pre-diabetes because their blood sugar here has started to come up off the baseline. But you can see here the insulin's even higher. And the final stage is now. Blood sugar's 11.4, that's diagnostic of diabetes at 2 hours. This patient would be told that they have diabetes. But have a look at the insulin. The insulin's actually not that high. This is demonstrating how the capacity of the pancreas to secrete insulin actually gets damaged when it's exposed to sustained elevated blood sugar levels, and your insulin level will then drop.